I'm Sarah Wakeman. I'm an obstetrician and gynaecologist, and I've also spent 3 years specialising in what's called reproductive endocrinology and infertility, so that's another 3 years of full-time training in the area dealing with fertility. And I've now worked in this area for more than 10 years. So I'm currently the Medical Director of Fertility Associates Christchurch, and we cover a large part of the South Island, including the West Coast and Nelson and Marlborough. I run clinics regularly up in Nelson. I would see people from the Nelson Golden Bay areas. Fertility Associates has been the main provider of fertility services in New Zealand for 28 years. Their success rates are fantastic, just as good as anywhere internationally and among the top few clinics in Australasia. We don't just do IVF treatment, there's a lot more to fertility than that, and we cover all areas of female and male fertility. PGS stands for pre-implantation genetic screening, and that's a newer technique where we're now able to biopsy or take a few cells from an embryo that's only 5 or 6 days old and find out whether it has a normal number of chromosomes or not. So a lot of the time when somebody doesn't become pregnant on an IVF cycle, or when somebody has a miscarriage, it's because the number of chromosomes in that embryo or early pregnancy isn't normal. We can therefore find that out for people. We can make sure that they only have the normal number of chromosomes transferred, and they will therefore have a much higher chance of successful pregnancy with that embryo.